Does your child have bad posture, or could their constant leaning to one side be a sign of something more serious? Scoliosis refers to an abnormally curved spine, a condition that tends to arise in childhood or early adolescence. Even severe cases can be improved with treatment, which would depend on the degree of curvature and age of the child. Physiotherapist Mr. Clement will provide an overview of scoliosis and discuss treatment options available.
Many types of scoliosis. So today I'm going to touch on idiopathic scoliosis. So idiopathic scoliosis, the cause is unknown. There's no any cause how the things happen. So which is where the abnormal curvature of the spine. So usually more than 10 degrees on the corpse angle is considered as scoliosis. And the common age about 10 to 15 years old. So usually very rare conditions they come with pain. Only some cases they come with some discomfort, pain on the spine. And basically sign we can see abnormal curvature on the spine. Kids who come to us, they come with a referral from the doctor, which doctor already diagnosed them. What we will do, basically we kind of like assess them. Basically we assess their activity of daily living, as example standing, sitting, walking. So these are the basic activity of daily living we assess. Then after that we check their corpse angles, and then through the x-ray. Then of course we use a scoliometer to check how much of rotation of the spine. And then from there we further the treatment from the assessment. So the treatment will be not only just by exercising, modifications of their activity of daily living, which is sitting, standing, and also the way they walk. Okay, our treatment plan for scoliosis we always based on risk of curve progression charts. So where we determine either the kids need to be observed or the kids need to be on brace with physio or surgical intervention. So that is a calculation behind it. So we'll calculate either the child need to be on brace or with physio or need to go for surgical intervention. So that will determine where our plan to the kids. Okay, as a parents, how you know your kids got scoliosis or not? So basically, you know when the age about 10 to 15 years, that's the puberty age, where usually the child's always shy. They don't kind of like expose their body in front of the parents or. So this is the very basic important age as a parents we need to assess our child. So basically we need to look at them, not even like exposing them, by seeing the shoulder level. Is it uneven level on the shoulder? Then second thing, we can see the shoulder blade, then we can see the hip. So and then we can see the way they walk. Is it abnormal walking? So and then we can see the ribs, the front ribs. Is it protruded or not? That means it's like rotated to one-sided or not. So these are the basic things as a parents you can check. Another things you can check we call as Adam test, where you make it both hand closer together and then you bend down. Then you can see is there any rotation. Rotation, that means you see there's any harm on the back. So these are the basic tips as a parents, so we can diagnose it your child earlier rather than their curvature is too much. Then of course surgical intervention. So we can prevent it, the surgical, by diagnosing our kids in early stage.
If you suspect your child may have scoliosis, see one of our specialists, because early treatment can prevent future complications. Gleneagles Hospital, Kuala Lumpur has your back and is on your side.